We are here. I am here at the Hanover Insurance Company, Hanover headquarters in Worcester, because the mayor's mental health task force is meeting right now to sort of think about and plan how we're going to sort of move forward with mental health from where we are, all of it. And Kim Salmon is the chair of the task force. She's also here. She invited us all down. So she's going to be joining after a little while. I'm kind of starting us off with some basics about mental health and mental wellness. One thing that I have learned through the pandemic as we've been out there in the world, that there's a lot of misinformation and misunderstanding about mental health and mental illness. And we've all heard of stigma. I got a slide about it, but my thinking is that a big part of addressing stigma is giving people accurate, usable, honest, research-based information. So that's my hope for the beginning of this time. And then after I do some informational stuff, we're going to shift it over to Kim, and she's in the bigger room with the bigger meeting. And it's exciting. It's going to be great. Thank you all for being such loyal watchers of Trauma Training Tuesday and being right there with me, kind of going with the flow. That's been a big learning and a big theme, I think, of this time of pandemic is things are never exactly the way we want them to be. Very few things have gone the way we wish they had gone, but we've had to just be okay with good enough and making it work. And so I'm really grateful that everyone's made it this far, and here we are. So the first piece I have here is this definition of being trauma informed. And as you know, we're Worcester Addresses Childhood Trauma. So we're all about the recognition of trauma as a root cause of many social problems, personal problems, institutional problems. What we mean by being trauma informed is that you recognize and understand that things that have happened to you are going to make a difference in the way you're in your life. They're going to impact all of your life outcomes. And if we don't see that and understand how that's happening, it rules us instead of us having mastery over our own emotions and needs. All right, there we go. So stigma. One of the big issues about mental health and mental illness is that there is a stigma. The definition of stigma from, I think this is Webster's, a mark of disgrace or infamy, a stain or reproach as on one's reputation. So when we say that there's a stigma, we know that that means if you take this identity as a person with mental illness or struggling with your mental health, that is going to be cause for people to judge you and look down on you. Because of that, people don't get the help they need. And that's so problematic. Stigma keeps people from getting help. It keeps their families from getting help. It makes people feel like they cannot talk about this without bringing shame on themselves. Many people would rather tell their employer that they served time in jail than admit to being in a psychiatric institution in the hospital. I have this picture on the slide that I use all the time. I think it's so helpful and important, but it really highlights the differences in our beliefs about physical illness versus mental illness. So if you can see it, if you can see my screen, there's a cartoon and it has the exact same picture in the top panel and in the bottom panel. In the top panel, it's labeled physical illness. And there's a man lying on the ground and he says, "I feel like I'm dying." And the helper says, "We need to get you to the hospital as soon as possible." Of course, makes sense. Somebody's on the ground, they think they're dying, you're getting them help. The next frame, exact same picture, but it's labeled mental illness. The man says, I feel like I'm dying. And the helper says, just try and remember, a lot of people have it a lot worse, right? There is this belief that somehow we should be able to will ourselves out of mental illness, that someone else could talk us out of mental illness, that it's really just as simple as thinking about something different. And although there is some merit to kind of changing what you're thinking about and how you're thinking about it, this is legitimate. This is real. Mental illness kills just as commonly, as thoroughly as physical illness does. Yet we still treat it like it's not a big concern or a big problem. I know that people who are tuned in today recognize that suicide is a leading cause of death for young people. I don't have the stat about in comparison to other types of illness enough to really make us take this seriously. And now more than ever, we're hoping that people recognize this and take this seriously. A big important piece about stigma and mental health in general is the culture that you come from, and the idea of intersectionality. If you haven't heard the word intersectionality, I'm not surprised. It's a very college campus word, but the idea of it is that all of us have more than one identity. So we belong to a racial group, we have a gender, we might identify as gay, lesbian, bisexual. We have a national origin. We have abilities, disabilities, many, many pieces to who we are. And those different pieces in our country, in our culture, those groups are afforded different amounts of power. We know that if you're a white, you're going to be given more power than people of color. If you're male, you're going to be perceived as having more power. Ability, disability, we know pretty clearly who has power and who doesn't in our culture. When you have a number of groups that are not the power group, that really significantly adds to your stress level right at baseline. Unlike the world of work and the regular many other environments we're in the realm of mental health, men experience significantly more stigma than women. Men are really discouraged from talking about feelings, having feelings, dealing with their feelings in ways that women are not. And so that's huge. Men and women, at least in my experience, have the same sort of emotions and responses, but they get really different validation in society about whether it's okay for them to show those feelings or not. We also know that Worcester has such a big immigrant population. Many people were not born here. They're coming from another country or another culture. Even if they were, many different cultures are even further back in their understanding of mental health and mental illness. Our country has so long to go, but we're at the front of the pack. I think maybe, Canada, England, some of those countries have done more than we have, but the vast majority of countries have done less than we have. And they still are really seeing mental illness as a weakness, as the person's problem. Some cultures really even believe that mental illness comes from demonic possession. Almost all of these explanations for mental illness put the person experiencing the symptoms at the center of blame. If you know you're going to get blamed for what's going on with you, it's going to make it that much harder to come forward. And that's really exactly one of the things that's happening now in the post-COVID world is people they're not coming forward. I have a teenage son, he's 16, and when he was really little, I bring him all over the place with me, and he used to want to be a psychiatrist, right? He was really interested in mental health, and he thought it was really important because he was learning well from me. But now that he's a high schooler, he has said, I wouldn't do any sort of mental health program or activity, nor would my friends. I think that's typical for adolescents, and especially for boys, to feel like they can't even talk about it, or let alone get help for anything related to their mental health. And right there, that's such a big problem. That absolutely needs to change. So the more we recognize that people have really kind of specific needs around getting mental health support and intervention, we'll be doing a better job. One of the things about mental illness is, I think what we have to understand is that life exists on many levels, right? There's things that are going on within us, sort of our internal landscape. And that is really the space of mental health. What happens is something impacts the way you think, the way you feel, and therefore the way you behave. And when this happens in negative ways, and it results in functional impairment, which substantially interferes or limits your life activities, that's when we're going to call it illness. That's when we're going to kind of diagnose you and try to connect you to some help. Let's see. It's stress that overwhelms. All of us are wired to manage stress, right? We know when we are stressed. I call it kind of my blood boiling. When I have those sort of physical, something stresses me out and I start to feel anxious, and I can feel those physical symptoms. And that's part of this understanding, is things in our mind cause responses in our body. So mental health, it's a real thing. When we perceive that something bad could happen, that there's some sort of threat to our thinking, to our body, to our feelings, to our sense of self, that can be overwhelming. Our stress response goes into overdrive, and it can be really hard to just kind of cope. The most common thing that happens when we're in this place is we lose our ability to control our emotions. We talk about it, and we can see it so easily with little kids, their emotional dysregulation. They can't calm themselves down, or they can't make themselves smile. They can't just go move on with it and let it drop. Those things are hard. That's the space we're talking about, where your feelings are controlling you instead of you being able to feel like you have a handle on it. It can really debilitate things in your world if you feel like your emotions are going to get out of your control. Another really important piece here is that you believing it is what matters more than anyone else's reality. All of us come from, the intersectionality place. We're all unique in our ability to interact with the world, how we interact with the world. So if Nerissa and I both go to a party, and I go there thinking that I really didn't want to be here in the first place, I'm going to have a terrible time, this is a big waste. And Nerissa goes there like, I can't wait to see all the people. I can't wait to meet people. We're going to have different experiences at that party. We just are. That's the kind of thing we're talking about when I say reality is personal and subjective. If somebody believes that no one here likes them, or that everyone is suspicious of them, that's going to impact their behavior. They're going to behave from that belief. So that's kind of an important piece of understanding this, especially when we're talking about young people. Sometimes the beliefs they have about what's happening, about how they're perceived, are really impacting how they interface with the world. And it's causing problems a lot of the times. When we diagnose mental illness, we use this idea of within normal range. So you're worried, but it's within a normal range. Right out of the gate, we need to be worried then, because this idea of normal, completely personal, completely subjective. Excuse me. Whatever you grew up with, whatever you saw around you, whatever people in your neighborhood were doing, that's normal for you, right? You don't really start to know that other people have different situations and realities and relationships until you're older. You go to other people's houses, or maybe from TV, media. All of this stuff, right, means that what's your norm is going to be real different than anyone else's norm. Normal is different by age, as we know. Something, if I'm acting really kind of all over the place, that will be concerning for people. But if I were a teenager, that's much more normal. So it's important to know that we have kind of different measuring sticks for different populations. In general, your brain is not fully developed till about your 20s. So that is definitely impacting how you see things in the world and how you respond. In almost every mental illness, eating and sleeping get impacted. You eat more or less than usual. You sleep more or less than usual. And when those things are off, everything else is harder, more serious, more challenging. Probably, you've seen it you see it with little kids really all the time. Like, they need a nap, right? That's us sometimes too. We don't always identify it or recognize it, but I know if I haven't slept well, something that would normally be irritating can be hugely disruptive to me. Things are much more dramatic if you're not eating and sleeping. We use this kind of standard. We kind of judge you by yourself. We think about, are the problems that you're having right now impacting your ability to be a mom, a parent, a daughter, a teacher, a learner, all of those roles we have in life. So the DSM is the kind of Bible of things mental illness, and it's asking us to look at, how are we doing? Are we having an okay time of the things we want to do? Or do we think we could be doing better and doing more? Sorry. Another important concept in this realm is the idea of the iceberg. This is important to know, especially when you're thinking about other people in your world. If you see anxiety, if you see something that maybe you're worried that the person might be suicidal, or you're worried that the person is abusing substances, if you've had enough evidence to create that worry, you're almost certainly right. All of us work really hard to keep those things that we're embarrassed about or ashamed of underneath the surface, to keep it in check. And when it's popping out, it's usually because there's a lot more of it. Like the iceberg, right? That was the whole thing about icebergs. You see that little piece, but boy, it started way back there. The boat hit it because I couldn't see all of that was there. Know this so that if you do feel like you're worried about somebody, you probably validate. You're right. You probably should be. And please use that as reason to check up on people. So much of the world right now, what has been impacting us is trauma. Trauma is something bad that happens, that overwhelms you, that gets our stress response going. It would be upsetting to anybody. We know that COVID has been traumatic for many people. It's definitely outside the scope of our regular reality and distressing. People are really unique and individual in their ability to manage stressors. So the stressor itself isn't the indicator of whether you've been traumatized. Some people can go through something traumatic and it's just another day for them, or their baseline is really different, all of that. And other people, something that seems really small to you is huge for them. Everybody gets to sort of have their own way of facing this and dealing with it. And when we're talking about trauma, it can be like one bad thing, or more often, especially in childhood, it's bad thing after bad thing after bad thing. That's definitely been one of my big learnings since doing trauma work and through the pandemic, is just that one bad thing is usually just the first domino, and then more and more bad things happen. When the first bad thing happens, a lot of times it takes away your ability to respond with calm, kind, control. And then because of your response, things begin to snowball. A lot of times when people are in trauma, we want to control them. External forces want to come control. And a lot of times that creates a whole other bunch of problems and secondary issues to the original trauma. So it just can really keep compounding. When this is going on, your fight, flight, freeze, friend, all of that is going on and continues to go on. If we don't stop and look at it and reflect and just kind of process what has happened, then it's just going to keep impacting us. A few sessions ago, we did unseen patterns, and that's what I'm talking about here. When you don't see that you got into this situation and you don't trust people, and that's why you had this bad experience, you can't do anything if you don't see it, right? You just think this is just who I am, this is my personality. But when you start to understand that it's about something that happened and you can make sense of that, then you can get more mastery. So that's a big piece of what we hope, is that people look in and understand themselves a little bit better, and that their behavior makes sense to them. We know that here in pandemic, this has been overwhelming, uncontrollable, unexpected. A lot of the things that we usually did to sort of cope, like, going to the gym or really working a lot more, we didn't have those tools available to us at this point. And so we've had to do really different things, which adds to our stress level. People have been saying that we're like gearing up for the mental health crisis post-pandemic. And the reason they're saying that is because trauma, it's post-traumatic stress disorder. When you're in crisis, which we all pretty much have been since, March 2020, you're in survival mode. You're just doing the things you need to do to get through it. My friend Reverend Payson, who's done a couple of our trauma trainings, what an amazing instructor he is, has talked about this, like, this is like being in a war. It's longer term. It's not a one-time event. It's this event that just sort of has drawn out, impacted everything, all of that. When we have actually learned the most about post-traumatic stress disorder from combat vets. Well, they're in war, they're doing all right. They're doing the things they need to do, all of it, right? They're just going. It's when they stop and they're away from the front lines, they're relaxing, they're trying to be with their families. Now all that stuff comes up and they're like, oh my God, what did I do? What happened? Where have I? Whoa. And that's why it's called post-traumatic stress disorder. None of us, it's very unlikely that we've kind of sorted through our stuff all that well during the pandemic. It's much more likely that as we begin to get back to normal, we start to really reflect on things, and it's upsetting and overwhelming. A lot of times we develop coping mechanisms, ways of getting through difficult things. And then a lot of times the ways of getting through, when we're not in that difficult situation anymore, those things still stay there. And now they're barriers, they're causing problems, right? It's a pretty good idea if you're in wartime, maybe to not trust people, to keep yourself safe. You can't just trust anybody who says that they're gonna help you. But then if you continue to not trust people, that's really gonna put a barrier between you and important relationships. when people have sort of post-traumatic stress disorder, a lot of times this plays out in adult relationships, romantic relationships, coworker relationships. So much trauma happens in relationships with other people, that's going to be where it continues to play out. And also the healing space, right? That in between people in relationship. The symptoms are usually effective in getting you through this trauma, but now they're still there. It's really about regulation is kind of one of the ways we think about it and talk about it. And it like a pendulum, right? The same person, our whole culture, anything, we can go from one extreme to another and have trouble finding that middle ground. You know that like every self-help, they're always talking about balance and moderation. And I think that's like because of trauma, right? When you either are like feeling too much or too little. You're completely alert, over alert, or you're shut down. We have trouble finding a middle ground. Guilt, shame, self-blame, withdrawal, disconnected, all of those things can be symptoms of trauma, symptoms of depression, symptoms of anxiety. And when people have had these things happen, their baseline stress level is so high that just adding a few more things can really send them over into zones where they just feel like they cannot cope. Knowing this information and sort of about our stress response is particularly important when we think about kids and developing brains. Our brain isn't fully complete until like our early 20s. And that's a little bit scary, given that kids are building brains right now in this time that they're not having access to all the kind of caring relationships that they had before the pandemic. Your brain is a use-dependent organ. And that means that whatever you're doing, it prepares to just keep on doing that. So every experience is going to shape it. And I have pictures here of roadways and pathways, because that's actually what it looks like in your brain and how it develops in the same sort of ways. If I want to cut over to my friend Ashley's house, I might cut through the woods, and that top picture would be this little path. If I do that every day, that path is going to be a much more worn path. And then if there's a lot of emotion in something, it supercharges it. So the more you're taking this route and the more emotion in it, that becomes your sort of brain highway. So if kids are having lots of experiences where they're mad and they're sad, they're building mad, sad brains. And then that becomes sort of their default and that what they kind of are doing the most. If kids have experienced abuse in their childhood, back to that idea of normal, that's normal for them. If that's what's normal and that's what they expect, no surprise, they're going to find themselves in adult relationships where they're experiencing abuse. That's part of the problem of this time right now. Again, things happen post-trauma. This is science. These reactions and responses are predictable. They relate to what happened to you. You often are all in again. You can't stop thinking about it. You're having disturbing dreams, flashbacks, or you're out. You're disconnected. You're numb. You're peace outing. But all of these things result in dysregulated emotions, feeling angry, volatile, suicidal, homicidal. So many things result from this. In the world of mental illness, we think about disorders of mood, your feeling state, and we also think about anxiety disorders. Anxiety is, again, useful in your brain, in your biochemistry. It helps you face scary things. But again, the problem is a lot of times you can't turn it off. It becomes maladaptive. Trauma impacts our behavior. we're not our best selves when we are struggling. I have this story that I got from Stephen Covey, who's this success guru, but I feel like it shows it so well. He talks about being on the subway, and he's on the subway riding. This guy gets on with his kids, and the kids are like, hitting the walls, running around, like just really kind of disruptive and out of control. And Stephen's like looking at everybody. Nobody wants to say anything. Everybody's bothered though. And he gets up the courage and he says, "Sir, like, you think you could do something about your kids? They're kind of bothering people." And the man says, "We just got back from the hospital where their mother died. I don't know how to handle it, and I guess they don't either." When you hear that, hopefully your opinion change, right? That's the hope, is that we can have empathy and understanding that people are doing the best they can. If they're not in control, they don't like that either. They want to be in control. It's too hard. It's too much. If the adults can't take it, we can't really expect the kids to. One of the most common responses to trauma and struggling with your mental health is to try to self-medicate. And people do this with all kinds of things: drugs, alcohol, work, sex, lottery tickets, all kinds of things. This little cartoon, I think, kind of helps you understand what's going on when you see people using substances. And again, substance use is considered a mental illness. I'm upset, I'm struggling. I go to a therapist, and the therapist says, "Give me 2 or 3 months. You'll start to feel better in a few months." I'm like, "A few months? Are you kidding? It's been so hard for me to get here in the first place. I can't wait a few months. I can't handle a few months." And then they said, "Well, why don't you go see a psychiatrist?" And the psychiatrist, as he is wont to do, will give you typically a prescription for something. And even that, give this new med 2 or 3 weeks, and then you'll start to feel better. 2 or 3 weeks. Then I go to the corner and I see the bartender. And the bartender says, "Give this shot 2 or 3 minutes, and then you'll be feeling better." Like probably most of you, I want to feel better in 2 minutes, not 2 months. You can see why people will begin to use substances. It's the perfect example as well of how the thing that started as a way to help you cope now is its own problem. That's a big part of what we see in this realm. This next part now, I'm going to be, I think, turning it on over to DJ. I have with me today, I hope, Nerissa, Harper, Ketter, and Diogenito Jorge, who are my beloved staff at Worcester Addresses Childhood Trauma. And they do the most incredible work to help people get through this time. DJ, are you on?
Yes, I am. Good afternoon, everyone.
Hi, DJ. Would you like to talk sort of about this piece of basic needs and what you do and how you do it?
Yeah, absolutely. So again, good afternoon, everyone. My name is Juliano Jorge. I am part of Worcester Addresses Childhood Trauma. Thank you for having us. I'll speak a bit to kind of what our daily routine would look like pre-COVID, and then kind of walk us through post-COVID. So pre-COVID, we had the luxury of assisting our families in the physical. So we were able to make home visits where we had a better sense of what they were kind of going through because they were in their safe space. So through that, Nerissa and I would kind of, again, introduce ourselves and let them know that we're part of the community and how we can assist. I think the thing that makes Worcester unique is that we don't go in with a action plan for our families. We kind of let them write their own action plan, decide what they need, and they're the author and the experts in their family. So we kind of take what they're telling us, and then we kind of come together and create an action plan that best suits the family. Oftentimes a referral may say, a family is struggling with finances and their main priority, at least on paper, is housing. So once we get that referral and we enter the homes, it turns out that the main priority, yes, is housing, but for right now, what we need is, my kiddo may need a coat, or I may need to address their academic status because they're struggling in school because the teacher says they became violent, they're showing ADHD, they're kind of bouncing off the wall, et cetera, et cetera. So we take into account everything that our families are telling us, and we create this action plan. And we're like, okay, so to reiterate, what we're looking for is more support when it comes to your child's academics versus housing, where it is important, but for right now, we're struggling internally with this issue, right? Um, again, we do the best that we can to really create an atmosphere of family. The assessment that we do is family strength based, which really kind of helps the family feel better of themselves and what they do. And the number one question that we tend to ask in these assessments is, what is it that you're best at with your family? What do you love about your family the most? And 9 times out of 10 is, I want the best for my child. We want to do better. We want to progress. We want to address this issue. We've gone through this hardship, or we've been in this domestic violence situation where my child has been a witness to this. Now he or she can't sleep, they're having night tremors, they're not eating, like I said, hyperactivity in school, lack of attention. So we really want to address that. And then we kind of just move forward with that. So it's more than one big issue at the time. It's all these small branches of many issues that our families go through. Lack of transportation, having an interpreter, understanding what an IEP is in school. Sometimes the way we speak, when someone from a school calls our families, they're saying all these words that I don't get, and I just need to know, am I in trouble? Am I not in trouble? What's going on with my kid? And it's a simple, again, just being able to translate that. They would want a meeting with you because they noticed that your kiddo is struggling. So how can we help? Right. And it's just a matter of clearing that message up and, being a collaborative partner. Again, we're here to really kind of just help our families out. We're not here to isolate anybody. We can tag team with the agency, which we have in the past, whether it's the YWCA, Services, DCF. We kind of tag team and try to tackle the situation in a positive way, and figure out what is it that they need from us, what is it that they need from the next agency, how are we helping each other to kind of, again, tackle the issue and really help our families out. So again, we address it from a real place of community, a real place of family. Again, we let them kind of tell us what it is that they need and what their priorities are, and I think that's the beauty of with the acts. I don't know if I answered that correctly or not.
Sorry, I had myself muted. No, that excellent, DJ. Thank you so much. I think too, if people have never seen this idea of the hierarchy of needs, that's what that pyramid picture is. It means that, like, if you are not in a safe place, if you don't have predictable food, if you're food insecure, then we can't really be worrying about like your self-esteem. That you really need those basic needs met before we can do some of this work on your mental health. And recognition of that is really important to our model. And DJ and Nerissa do a great job of really starting there and making sure people have their most basic needs met before we begin to expect them to live optimally as their highest selves. Nerissa is going to talk, I think, a little bit more about what happens in relationship and the kinds of things that we can do that help people. Go ahead, Nerissa. I'm going to be quiet now.
Hi, everyone. I'm Nerissa. So just in talking with our families regarding like mental health and I mean, I have a couple of strategies that I like to use. They've been successful. I've been in the field now for over 25 years, and you pick up a few tricks along the way. So I notice one thing, like DJ said, a lot of these families, they're feeling isolated, they're feeling overwhelmed, like they're drowning, they're feeling like they're totally forgotten about, or oftentimes they feel like, their problems just, they put their self last a lot of times when they're thinking about their families. But one thing I like to get the caregivers to focus on is their positives. Every family has strong points. So I like to focus on the strengths and the positives, because you can get overwhelmed and it can just be such a burden to think about, all the negatives. So to focus on the positives, sometimes we have to think out of the box. I like to focus on the positives and let them know that they're doing the best that they could do in a difficult situation. And me and DJ also get creative when we are, especially when it's a mental health issue. We might be dealing with someone who, I'll give an example, who may be into some self-injurious behaviors. We don't want you to hurt yourself. We don't want you to draw blood. We don't want you to harm yourself in that way. But yet some people, if this is a coping skill that you've developed, maybe, we can help you develop a healthier coping skill. So instead of where, if you were a cutter, maybe in the meantime, until you get to your next, a new therapist or psychiatrist, maybe you can use some elastic bands, keep them on your wrist, and maybe, when you need to sense pain to ground yourself, you can just pop the elastic band on your wrist. You're not drawing blood. You're not causing like permanent harm to yourself, but you could probably, it's enough of a sensation to get you through a difficult times. So we get really creative. We do deep breathing exercises as well. We like to get them to use positive coping skills with their family as well. Maybe they were raised in a family that was very chaotic, and there were too many people in the household to really focus on every individual child. You can also, we've gotten families to use like a reward system with a chart where the family can engage in the chart every day. And at the end of a week, there's rewards, and it's not always food, not always, money. It could just be time spent. It could be a board game and they get to choose, or something as simple as that. So we like to let families know that they are not alone. We're here to support them in every way we can. But we all know waiting to get in to see somebody for mental health issues, the lists are almost eternal. So we're getting families to even stretch together. Even if you just get up and dance for a few minutes together, get the blood circulating, things like that also help with mental health as well. As far as like, your diet, what you're intaking, try to get some sunshine in, do things together, just getting really creative. And we've also dealt with families that, not pre, but post-COVID, they thought that a lot of these services were not available anymore. Luckily for Worcester Acts, we were able to, get a grant that allowed us to buy electronic devices for our families. So DJ and I, we've also helped them teach them how to use the electronic devices as well. Some families didn't know how to use them, but once you learn how to use them, they could do their telehealth appointments. They can join in other groups in Zooms. They don't have to feel so isolated. They can keep in touch with their loved ones. They can, do FaceTime. We just kind of, open their eyes to what is available out there. And, we're human beings. We're social people. So it's important that we all feel connected. So I hope that answered your question. But again, right now around the holidays, I just want to remind people during the holidays, if you work in a human service field with mental wellness, it's important to really keep an eye out on your clients that you are concerned about. Like now is the time of year where you should do a check-in. If someone's on your mind, you should check in with them. People really struggle during the holidays, and they may be, keeping these struggles to themselves. Sometimes just checking in on someone and letting them know that you were thinking about them and their family is enough to get them through the holidays. Because not all of us have happy family memories with during the holidays. So it just means a lot to people that you just check in with them and let them know that you were thinking about them and their family. So.
And the red sparkly antlers, you can't go wrong with those.
Happy December, everyone.
That's awesome. So as I said at the beginning, we are doing the Trauma Training Tuesday on the road today. And in the next room is the beautiful and talented and amazing Kimberly Salmon, our hostess at Hanover today. And so I'm going to turn it over to Kim for a minute. I probably will turn off my video and walk. But Kim's going to share a little bit about the sort of mental health task force, what we're doing. And then folks in the room are going to sort of talk about what things are going on in their worlds. We get the benefit of hearing this stuff all the time when we are doing this work, but I know lots of people don't and are interested to hear what's going on out there in the world. So do you, Kim.
Thank you. First of all, I really appreciate you giving us an opportunity to join this platform and really talk about just this past almost 2 years that we have come together. We have organized to really meet the emerging and exacerbated needs that around mental health that arose in the wake of this pandemic. And the reason why it's important to acknowledge that it's exacerbated, because we know that these issues, these challenges certainly predated this pandemic. And yet the resources, services, the systems were strained going into this and have continued to be as a result of this. And so this group came together because of that to really determine how could we really tap into one another, the networks that are there, and really try to do the best that we can to meet the needs and the challenges that were happening in the community around us. Little did we know that we would still be sitting here discussing this. And today, we spent a couple of hours together in person, safely, social distancing, to continue this conversation and to really try to look at what is it that we need to do moving forward. What are the immediate needs? What are the short-term responses? And then how are we really going to address these issues long-term? And honestly, all that we got through today was having a discussion about what the challenges are. So we didn't get beyond the challenges because the challenges are just so great. And I don't say that because I don't want you to think that, to what end do we just continue to talk about the challenges? How do we get beyond that? We will. I feel confident that we will. We will come back together. We will continue to meet. We will really start to focus in on what we can do to address these challenges that are affecting our community, affecting the people we love, that's impacting our children, that's going to affect our future. We will, in fact, get to a place where we can really start to have conversations that we're working towards this change. But we still have to start somewhere, and I believe that we have. So I am going to, I have several people who are in the room. This is going to be a challenge on our capabilities. So my mental health, our capabilities as to whether our system here is working. I have with me Jerry Juliano, who is with us, who is going to be sharing some of his perspective on what he's seeing from the state level, specifically the work that he's doing here in the city to really help support the systems and to look at understanding what the challenges are and try to work towards solutions. I have Eve Gilmore here, who is who really leads the Together for Kids and Rainbow Child Development, but Eve has really played a critical role for this city as a whole. She has been a key leader in understanding the challenges that our children and youth have been facing through this pandemic, and has really served as a resource for us to understand what happened as a result of what existed before this, and really has started to position us towards thinking beyond this. What do we need to do to, in fact, really support these systems that are in place, support our early child care, support the trauma that our children are experiencing? What is it that we need to do to support the workforce that is in this, that is doing this work to support our children? What is it that we need to do in terms of the infrastructure and building or rebuilding and reshaping a foundation for our children and our families? And we have also with us Dianne Langford James, who is from the Torch Foundation, who is here with us. And Dianne just brings us a sense of hopefulness. She has been here working with our youth and deploying some incredible programming to help with the resilience and support of our youth, and to really help give them an opportunity for their voices to be heard and for it to resonate beyond, for others to be able to be impacted by their voices, but first to start with self. So Dianne is here and is going to share some perspectives in respect to what she is seeing and has been kind of highlighted from our youth, and bring that message to us. And I believe that Maura Mahoney is also going to be joining us today as well. Maura is right here. I don't know if you can see her, but she is here. And Maura is going to kind of talk to us a little bit about what she's seeing specific to our education system, our teachers, our providers, and what they're doing to address the social emotional well-being of our students. So Maura is going to give us her perspective just in terms of what they're doing and how they're really using the community and community providers to really help to support our children in our after school program built within our school, but really how they're really looking at their entire wraparound services care. How are they approaching it? What are the challenges that they're having with being able to identify the staff to meet to fill the gaps, and to be able to be the resources that they are charged to be for our children and our families. And we also have, I believe, Sharon Henderson. Are you joining us, Sharon, in this conversation? No, Sharon is not joining us in this conversation. Sharon is just, she's actually been an incredible scribe for us throughout this process. So she's probably going to scribe a little bit more while she's here. So we're going to begin the conversation, and I'm hoping that you're going to be able to see everyone, but just in case, I have this laptop that is going to look kind of funny, but I'm going to move it around so that you can see the individuals who are speaking, and so that they can provide some insights. And we're going to start with Eve, but I'm going to turn off my camera for 2 seconds. This is going to be a little, exercise in, this is going to be a little exercise in creativity in our space. No, I'm going to bring it right over to you. Go ahead. Thank you.
Nice stuff. There you go. Yeah. Okay. Thank you. Sorry. No, well, it says no signal.
Maura, can she use yours?
Yes. I can just speak.
Oh, you
I
can
don't
just go
need
right
to-
in here. Just you take it, go right from the
Oh, okay.
laptop.
Okay.
There you go.
Okay, well, I see me on one level, but now I'm the other. Okay.
It's
so-
okay, you can just go from there. Got it. Amy, can you see her?
Yes, we can see you. Just
Okay. There we are.
there she is, ladies and gentlemen.
All right, thank you. Thank you for this opportunity to talk really among friends. There are many of you who I see participating in Trauma Training Tuesday today that certainly are fully aware of the concerns that we have with regards to our youngest children and our young families in the city, but also for the folks who are taking care of and helping to educate our littlest ones. So our parents and our educators and the many support organizations that help through early childhood mental health to enhance what's happening in our classrooms for young children. Right now, as Kim and others have mentioned, obviously the impact of the pandemic is being felt everywhere. And oftentimes we need to remember that the experience of our children is that of their relationship with the adults in their lives. And when our adults are at their best, then oftentimes our children are as well. Right now, we know that many, many families are experiencing a level of stress, a level of breakdown in their normal support systems, be it family or coworkers or neighbors. And that is having an impact on what's happening in our classrooms for children across the community at the early childhood level. The children that are engaged in early education and care currently are experiencing some of the most challenging times as their parents are back in the workforce and are struggling, as we all are, with the ups and downs of COVID and remote engagement at work, inconsistent schedules, having to cover backup for other folks who are out due to illness or other family concerns. And the stress has not abated as we go into this next surge. As a result, since September, we have seen in the early childhood community children's return to classrooms not post-pandemic, but certainly in the new iteration of the fact that we are going to engage in our routines, especially our educational routines as we move forward, that many of our children are experiencing delays in development, not necessarily delays that cannot be addressed, but delays due to lack of engagement and involvement with other children of their age, with adults around them, in a way that allows them to practice and develop some of the fundamental skills of young children. So being able to engage with eye contact, being able to utilize speech and language in a way that enriches their engagement with others, being able to self-regulate, to be able to focus for a period of time as they engage in an activity or play. And many of the children that are in our classrooms haven't had some of the guidance that they need during their fundamental months and years moving forward. So we are looking at working with children who need extra supports. And we've been very fortunate to have a rich early childhood mental health community of clinicians who, since September, have been able to be supportive to teachers and parents and help our children move along. But right now, there is a 3 to 4 week waiting list to be able to engage the adults in classroom consultation and/or meet with individual families and children. So that delay is creating stress for the classroom and for the children involved. In association with that, there are more children who do have medical and other significant developmental concerns, whose diagnostic opportunities are on an extensive waiting list of up to a year before they're going to be able to have the service engagement they need. And as a result, that jeopardizes their access to things like early intervention and other services because that diagnosis is not available. So needless to say, it puts undue pressure on parents as well as teachers to be able to figure out how to respond most effectively to children in our community. And we have been also equally fortunate that, as with other programs you'll hear about today, children, the educators and teachers and parents of children have had opportunities for support and continued professional development with a trauma-informed lens, with a racial equity lens, with the opportunity to learn more about child development. And hopefully that will help increase our community's ability to respond more effectively to children with reasonable expectations and more constructive and engaging guidance to children as they attempt to enhance their individualized working relationships with the kids around them and with the adults in their lives. We are in a crisis point as a field of early education and care due to low wages and an inability to attract an educated and experienced workforce. We have some extremely talented and long-term educators who've been part of the field and are guiding our new workers and educators in an effective way, but there is much more that is needed to provide the best for our children. The field of early ed is a highly regulated, licensed field, and as a result, it's critical that we get people who understand the specific needs of children engaged in this work. So we can work with our allies out in the community in a way to help the city and others recognize what other resources will be needed to bring a richness to working with our children and be able to help prepare the resources that will be necessary as we continue to address the pandemic and its concerns, but also to come out the other side with a more robust investment in our young children and the people who serve them. So thank you. Check. Yep. Oh. Oh, so I'm sorry. I'm going to turn it over to Jerry from DMH, but I'm sorry, Jerry, I forgot your last name.
That's okay. I'm all good. I'm going to introduce myself. Hello, everyone. Hi, my name is Jerry Juliano. I'm the area director for departmental health for the Central Mass area, and we're moving things around here. So thanks for being with us here tonight. So I wanted to talk a few minutes about the perspective from the Commonwealth of Massachusetts. So as I was saying, I serve as the area director for Central Massachusetts area, which is actually encompasses 95 cities and towns. We have 5 sites throughout the Central Mass area. And the pandemic has stressed every part of the system that we can think of for mental health. Some of the areas just to highlight that I would like to highlight include services for folks seeking emergency department support because we do not have access to adequate resources to manage the day-to-day mental health needs of most of our folks in the Commonwealth. So what will happen is when we're unable to access that, the emergency rooms tend to fill up with folks who are struggling, including parents, including kids, we're including grandparents, we're including everyone in this. People are struggling. People are really under lots of strain. And so what we're trying to do is find ways to take the pressure off of folks to help them to be able to be available to others to support them in managing the stress. So if you have a child who's in the emergency room, you probably want to think about how you're supporting the parents. And if you have a parent in the emergency room, how are you supporting the adult child who's taking care of the parent, and so on. And there's lots of needs here. One of the things that the Department of Health tries to do is to provide support through services such as case management and through outreach services that are contracted out through our provider service agencies. In trying to do that, a couple of things have come up with the pandemic. One is a staffing shortage. We just literally don't have enough clinicians and frontline workers to provide the support to the people we serve. And so thinking about ways to come up with creative strategies to not only recruit people, to retain people, and to continue to help them progress in their development as staff workers in the community is essential. So we are struggling and really looking for ways and solutions to support people doing the work on the day-to-day levels, because those are the folks who are helping to serve the clients that we work with and the communities that we work in. Another area the Department of Health is trying to support is in dealing with situations including schools and with the criminal justice system, is to provide options for folks in order to get services, not just if someone's in trouble and they have to deal with the police. What we're trying to do is to have mental health outreach and support services to provide another level of support to the families, to the individuals that are struggling, rather than just a specific correctional option. We are also trying to find ways to support folks who are struggling with many situations in which there have been involved with trauma and being very trauma informed in how we approach the work we do, because that's a very important piece of being able to engage people in recovery and in treatment. And I think there's an awful lot that we have left to do. And the pandemic has really impacted our ability to really engage a number of people in our community. And as you know, virtually, as we're doing today, there is certainly a role, and I think we'd be able to reach even more people by doing this. But there is also there is a difference when you're able to outreach someone in person and have that ability to sit one-to-one and talk. And we're trying to figure out the balance. There are some folks who are fine with this and do very well, and there are others that struggle a bit. So we're also trying to find a balance of how to support people in the best way that works for them as well. And finally, I'll just say one more thing about sustainability and resilience. These are two things that we've talked a lot about today in our group. Resilience having to do with each time we have a contact with someone, we want to build in a way to help them develop their skill set, whether it's a school system, a parent, an agency. How do we help them to build in a skill set to transfer to others in those moments when people are in crisis and are struggling? Waiting 3 to 4 weeks to see a therapist, if you're lucky, you can't hold that and wait for that in order for something to change. You have to do it in the moment. So really working in the moments to help people consider creative options to manage the crises. And then sustainability is another thing that we talked a lot about. And there is funding and money out there to try to put toward providing resources and services to folks. But if we don't have enough people to do the work, if we don't have enough people engaged in the process or are interested in doing the work long term or able to fund it long term, then we're not going to get very far. So we have to think more creatively of how we're going to build a structure, a system that's going to be sustainable for the future to support the needs for folks who are managing it and dealing with mental health issues. So these are some of the things that we discussed today, some of the topics we kind of hit on. And as Kim was saying, we certainly didn't get as far as we hoped we would. But this is a process, so we'll continue to talk about it and build off of this. So those are a few things that I wanted to share. So I appreciate your time and thank you for being a part of this. And I believe I will be passing it on to Maura, who's on the other side. So I'm going to, if you give me a second, I'm going to move this. And you got it.
All right. Thank you.
Oh, I'm echoing. Yeah, but then it echoes. Okay. Geez, you think after 2 years, we would have figured this part out, but this is a hybrid. We're together, but Zooming. So now I know what the kids and teachers felt like all last spring. It's really been great to be a part of this. I think a couple of unintended positives of the pandemic were the option of and the opportunity to actually meet with great people who have always existed, and we might have seen each other's names on things, but we've really been working together quite diligently for the last 22 months or so. The other thing that the pandemic has done is to really make people aware that mental health, the need for mental health and social emotional learning are a thing, which is a positive as someone who's done this work for about 30 years to see other people acknowledging it. So in Worcester Public Schools, we provide services during the day for all of our students. Each school, we have 88 school adjustment counselors, and we should have 30 school psychologists, but we have some vacancies. If there's any school psychs out there and you're interested, please go to School Spring or call me, please. And we provide universal sort of mental health supports for all students, as well as the tiered supports for the students most in need. We've been doing, that's always been our job. And I think that over the last couple of years, what we've really worked hard at is building the community relationships. We had a presence over the summer in some of our childcare settings, which was great for our staff and for the program staff. That's something we're looking to expand to be able to work with kids and families more outside of school. The other thing that we have noticed is the fact that the adults in the rooms have also gone through a pandemic, have also been isolated, have also faced some of the struggles. So we're really trying to identify ways to support our staff as well, because you can't fill from an empty cup. So if our teachers, our admin, our support staff don't feel supported, they're not going to be able to support the students as well. I do think that this is although 2 years feels like an awfully long time, and it has been an awfully long time, that this is a transition. This is a temporary situation. This is for them. This is really an adjustment disorder with mixed disturbance of emotion and conduct sometime, but an adjustment disorder nonetheless. And if we all pull together, we will make it out of this. It's, again, we have seen the cracks and the fissures in our society. We know where the needs are. And I believe that our community and everyone on this call, as well as countless others, are committed to using this as an opportunity to hit the reset button and maybe support people and treat people the way we should have been all along. I'm not sure is it back to you, Kim?
We are actually going to get Dianne's perspective in respect to what she is seeing in the work that she's doing and connecting us to our youth and resources and how they have been there for them. Dianne?
Yes, can you hear me? Okay, great. Hello, everyone. It warms my heart to be here with I'm having an echo, but it warms my heart to be here with each and every one of you in the good fight, because it truly does take a village to raise a child. Can you hear me? Thumbs up if you can hear me. Okay, great. I'm gonna talk about social emotional leadership training for teenagers. And I want you to understand how I got here. I raised 3 grandchildren for the last 20 years. And one day that grandson that was 4 was now 27. And he called me up and he said, Grandma, you get to come to this social emotional leadership training for adults because there's something inside of you that is stopping you from being magnificent. I'm like, hello? Didn't I just raise you, young man? But he's right. As Maura just finished saying, life takes a toll on us. And we get to be recharged, rejuvenated, reclaimed. And so I went reluctantly. And when I did, I found other like-minded individuals who wanted more, who wanted to be more and do more. I had lifted my head up at that point in time and realized that I had broken cycles in my own family. I had broken cycles of addiction. I am 30 years clean and sober. I broke cycles of education. I'm a Worcester State University graduate. I have broken cycles of spiritual soundness, financial bondage. And when I lifted my head at that point in time, I saw the kids out here cutting themselves, depressed, suicidal, literally killing one another. And I'm like, when did this happen? This was in 2015. And I looked at my family and I said, it took me 20 years to do what I did. How can we do this as a village and take back our teens and interrupt these cycles and these patterns and these generational curses that are happening? And when I finished the training, and I don't know if most of you are familiar about transformational training, but I'll tell you a little bit about it. I realized that this was the equation that we were missing. There are paradigm shifts that happened, and this was one of them that could fill the gap for humanity. You know, we have fatherless children at home. We have motherless children at home. We have both parents at home. There are 3 places, home, school, and they get to have a third place where they feel safe, where they acquire tools and techniques to take responsibility now that they're teenagers, where they can make better choices and understand urgency and timing. When I finished the training, I saw that the adult training was condensed down to a teenage one, and they were charging $295 for a 2-day training, 1 month of coaching, a graduation with certificate. And trust and believe, when they finish with the training, they are awake, present, and intentional. They have taken their story, and as Oprah would say, we all have a story, and taken that story and reframed it so that they win and that they don't lose. They understand that they're perfect and whole as they are. They just haven't been here long enough to acquire the tools to make better choices. And so I went to the founder because I had befriended her, and I said, well, what about the inner city kids that don't have the $295, or their parents are working and don't have it? And she said, I have the Torch program. It's been laying dormant. And this was in California. I asked her to state certify it, federal certify it. I was taking it back to Massachusetts. This was in May of 2015. We have been in Worcester since May of 2015. And I'm so glad the foundation is in and sealed. And now we can create this movement. We've done trainings at Worcester State University, at Clark University. Clark University also did a third-party evaluation for us in 2018 and 2019. And not what Dianne is saying, but what the data says, that 100% of our youth see value in what we do. They are awake, they are present, and they are intentional. So I'm here to give hope. I understand that when I gave a training to the Department of Public Health, they said, this social emotional intelligence belongs right beside mental health, because social emotional intelligence is a pebble that will turn into a boulder if we don't address it. While we do the interventions and the things we get to do, we can do what's called prevention or early intervention. And as we take this mental health, which is so variable, and I know we're all dealing with it at some point, or in our families or with people that we know. I know that I am personally dealing with it. And as we figure it out, I think of HIV/AIDS and when it first came about, and how there was so many variables going on, and today they have a handle or whatever on it taken care of. And I think of mental health in the same way. There are so many variables going on, and there's so much work for us to do as a people. And collectively we can, as she was saying, let's find our allies and let's work together Because when we link up together, then we can create a movement, and magic happens, and we can break these cycles. And today, 20 something years later, instead of having generational curses, I have generational blessings. I have grandchildren that are at BC College right now with full boats, but it takes work, and it takes us to be together to be able to do the thing. So join the movement. It is thetorchfoundation.com. You can look it up, thetorchfoundation.com. All teens go free. We raise the money so we can invest in them. And when we do, their grades go up. Their attitudes change. They realize hurt people, and they're not going to be part of the problem. They're going to be part of the solution. Because now wherever we go and wherever everybody else fits in and works together, they're learning, because it's always about what's next and what's next and what's next to build the country, and we can take them back. I want to say that it is a pleasure being here. Transformation is from the inside out. We've been putting Band-Aids on things for a very long time. And then when life happens, people take one step forward and learn, and then life will happen because it will. It's called life, if you live long enough. And then they take 10 steps backwards. We get to support them in being grounded and take responsibility instead of wanting to change everything and everybody else. Guess what? The person you can change is yourself. And to understand the time is right now, and there's urgency in what we do for our kids. We all know that, especially since the pandemic. We've been here for 7 years. And right now, social emotional intelligence is a priority. As the mental health is, we're here. So I am happy to be here. Any questions, you can reach me through thetorchfoundation.com. We're there. I will send flyers out so everybody can see the next training that we'll be doing. We have 6 this year. And we're doing them virtual right now for the safety. And as soon as we can get back, CDC regulations, we'll be back in person. And we can take Worcester and really make it a model for all other cities. I am complete. Happy holidays, Merry Christmas, Happy New Year, safe and all that good stuff, and looking forward to our continued relationship.
Thank you so much, Dianne. That was the perfect way to kind of bring us full circle, just in the respect as we sat here. And that was actually the way we closed out our full discussion today, was with Dianne, which was really fitting, considering we spent the entire time really talking about the challenges that we see ahead of us, the things that are happening today, the fact that we are all still deep in trauma, and the fact that thinking beyond this, that there are not enough resources, that we have the funding, but not the people to be able to actually deploy the services. We have a great need in our community, and Dianne, what she did for all of us is reminded us that there is hope, that there are programs that are successful, and that we can really hone in on that and take it in and really deploy it and push it out. And that it is, that as she said, a village effect, that we can take these learnings, these successes, these models that really do work, and we can use them, and we can build on them. So Dianne kind of stopped us where we needed to stop to realize that the opportunity really is available, that we will be able to take our community forward, and that we will get beyond this. Although at times it feels like it won't. So thank you, Dianne, for that. And thank you, Eve and Jerry and Maura, for just giving a little touch on what we discussed today. And as you heard, I mean, we have a big, long road ahead of us. And I think it's no different than what each of you have been experiencing in your own organizations and what you're seeing today. I think that in order for us to truly move this forward, we need to, one, as individuals who are doing this work, come together and support one another and build a support system for each other. But we need to link these conversations and remove the silos if we're really truly going to be able to push this forward and get to some of the root causes, and to be able to truly support our community and our well-being and our mental health. We need to start to have these types of conversations. We need to work together on how we're going to approach this. So with that, I wanted to just open it up to, I see Audrey, I just love that you just popped up on my screen, Audrey. See, that works for my mental health, just to see your smile and see you there. I haven't seen Audrey since before the pandemic. So I am, even though it's virtual, just wonderful to see you. So does anyone have any questions for anyone who spoke today? And I know that we are going to transition to you, Audrey, but before we do, I just wanted to see if anyone had any questions for any of our panelists. It wasn't really a panel. Amy kind of said we are doing a panel, and we said, well, we're going to have a discussion. So, of course, you guys, those of you who know me, are probably not surprised by that. But so does anyone have any questions that you'd like to push out there?
A request, could Dianne put her contact information, her email in the chat, please?
Absolutely.
Jennifer, do you want to say anything about the equity roundtable?
Yes. Thank you, Amy. Just before the pandemic, literally just before the pandemic, a group of us who have been working in the area of education and youth services came together to solidify the ecosystem of those of us who are involved in youth work and education. And we came together as the Worcester Education Equity Roundtable, which is a partnership of organizations that are involved in this work. One of the subcommittees is the Social and Emotional Learning Subcommittee that Amy chairs. And we've been working on a number of lunch and learns and other activities that will support the kids. So for example, in the wake of the storming of the Capitol, we brought in Facing History and Ourselves on how to have difficult conversations with kids. When kids see adults out of control, it rocks their world. That's a technical term. But it's that sort of work that we're doing and trying to push this concept of universal social and emotional learning out to the community so that all of us understand what kids and adults are going through. And as was stated before, this is something that has affected all of us. And our response to this will need to be nimble and iterative. So thank you for this opportunity, and thank you for putting this together and everyone who's been involved in it.
So Amy, do you want to help just navigate through? Did we have any questions in the chat that we want to call up?
I did not see questions. I think you should do it, Kim, because I'm echoing.
Yeah, I think only my computer, because, we're at Hanover and it's my Hanover computer. It will only acknowledge mine here in the room. No, you didn't get that, Amy. Katie?
Hi. So my question is just, I guess, what can we do to support school-based staff right now? Because we're still in the middle of ongoing trauma. So what can we do right now to support them? Because people are just crashing and burning and are just really unable to then support the kids. And there's all this kind of primary and secondary trauma going on simultaneously. And I just don't know, how to intervene right now.
Well, I'm going to push this to Maura, but I'm going to be honest. I mean, this was part of the conversations that we had. This is ongoing. Is the reality is that it's not just our children that we're concerned about. It is truly our providers, the impact that this is having on them, our parents, our teachers, that this is really affecting everyone. But Maura, do you want to speak just in terms of what the school is currently doing to try to navigate through this, but obviously understanding that we still truly don't have all the solutions?
I don't. All right, is that without? I don't want to echo everybody because no one needs to hear me 3 times. Once is enough. I think that and I'm not sure what your role is, and talk about. I think it's great about what can we do to support educators. I really think that it's the same that we need to do to support everybody out there. We need to acknowledge, I saw a thing on Facebook that, the world is short-staffed, and it truly is. And I think that we need to just, look within ourselves. How do we support people? If you're working in education and you see someone that you work with who's maybe having a bad day, or, a bad week, or a bad pandemic, what can you do to support them? We also have to realize that what one person feels is supportive is not what everybody feels is supportive. So we really need to create an environment where if we're concerned about someone, and I think that adults, just like kids, and the same thing with adults in schools, that if you look at sort of the social emotional triangle, on any given day, 85% of the folks have what it takes to get through whatever's going on. That doesn't mean it's all unicorns and rainbows, because it's not, but we have the skills to get through it. There's another 10% who maybe needs sort of that tier 2, a little more support, like to say to a coworker or someone you're supervising, a friend who's in education or anywhere, it seems like you're going through a tough time. How can I help? What do you need? And then there's that very small percentage who really need direct intervention. So I think just keep our eyes and ears open. We are working with principals and school staff to offer, just people ideas on how do you, and I think self-care has been overused in the last 2 months, but what do people need to make things better for themselves? Is it going for a walk? Is it getting a coffee? Is it, knitting, whatever different things? And don't assume that what makes you feel better will make someone else feel better. I had said earlier, for me, someone said to me, oh, why don't you, go for a run and then knit? That would have me in need of further intervention, because I have done both rather unsuccessfully in the past. So just open your hearts, open your ears, open your minds. What do people need? And, we will get through this. It's not going to be easy, but we do have what it takes. So if you know someone in a school who, might need an ear to talk to, and also too, to remind folks that this is normal. What we're going through right now, unless it's, a ton of red flags, this is what happens to humans when things like this happen. And we'll get through this, but we're not going to get through it without each other.
I think the other confounding variable is like,
I'm sorry,
this feeling of like cognitive dissonance between this, like DESE and administrators and then staff, right? Like, I think I work in 11 different districts, and I see it everywhere, that there's this kind of feeling that the pandemic is over and that we're back to business as usual, and that people are being asked to do exactly what they did pre-pandemic. And I think people are just stretched to their breaking point. And I just don't know what can be done about that too, besides like continuously just talking to administrators about the fact that like we can't be asking people to be at full throttle right now. They just aren't, they're not there.
Yeah, and I think that and I'm just going to kind of connect on that just from a lot of the conversations that we've been having is that although people are acting as if the pandemic is over, it's not. We're still deep in it. And I think the challenge is that we're still looking for answers. We still don't actually have the answers to how to get out of this in terms of our own mental well-being in the midst of trauma. We're all still in it and it's still building. And then I think to the fact that we truly don't have, these barriers pre-existed, these challenges pre-existed. And I don't think anything prepared us even for that return to school. Like if you look at it in the way the system's made up, and this is flaws and all, is that, there were the things that were still known and what you could anticipate. You always anticipated that your seventh grade class was going to come in and be a little, that we're going to need to adjust, and you would put more effort towards them. Your freshman class would come in and you would help them to acclimate. In this case, you had 2 freshman classes all coming in, your sophomores and your freshmen all come in trying to acclimate into a system that they were completely unfamiliar with. And this goes down all the way to the beginning. Our kids who, were coming into kindergarten who, didn't have the in-school experience, missed out on the pre-K experience because of the pandemic. We were not prepared. If we were struggling before and the systems were challenged and strained, how did we really prepare for it? We didn't know how to. We didn't have, the tools to really address it as it all hit us. As it just happened, it all rolled out all at once, and we were trying to navigate it, but the problem was so great. So Katie, I hear you, in the respect that, our families, our teachers, our, adjustment counselors, our schools, our systems are struggling. They're struggling. They are having a very difficult time. And we know that these challenges already existed prior to, but it just got bigger. And we can't, as much as we were talking about, with Eve, who was having the conversation with us about, the time for the kids to be evaluated to determine what's happening with them. The fact that these kids missed out on a lot and they're coming in and they are, being observed and because they're demonstrating or they're observing signs that might be on the spectrum, when it could just be a year of no connection, no interaction. Now, by no means am I a clinical person, so I'm not qualified to state that. But I think you are. Thank you. But I think, just understanding. So, but obviously this is really why we came together as a whole today, why we've continued this conversation. And I think it's an opportunity, I think, as we continue this conversation and what we're going to do to really start to get to the core to this and push this forward, is to have more people at the table so that it is an inclusive process. And we're really thinking about how do we hear everyone's perspective? How do we come up with solutions that really work for everyone, and that, a path that is really thoughtful of that and how we move forward. But I'm going to transition because what is this? Did someone put Kim? Oh, I thought so. I was like, am I supposed to give funding? It was Amy's comment that just posted up in my thing. I'm like, am I supposed to give funding and that will change it all?
No one
If
told
I-
me.
if I may.
Is that why Amy called me on this? What? No.
Kim, can I say a few words?
I will let you say something, Dianne, but after you, I think that this kind of, when, Dianne talk about, systems and models that work, I think this is the perfect time to transition to Audrey to talk about the new model, the new trauma. See, I can't speak. It's been a long day. The new trauma clinic, children's trauma clinic that she has started at UMass, so we can kind of get an understanding of what they're doing to respond to this, and then in effect what we can do or learn from her, and what we can bring forward to some of our teachers, providers. And that was my 45-minute timer to tell me that I had to make sure that Amy, that I did the right transition. So Dianne, real quick, and then we're going to go over to Audrey.
Okay, really quickly.
And we're going to mute.
I'm echoing again. Really quickly, I'd be remiss if I didn't say what is in my heart and soul. It took us so very long about the social emotional intelligence for teens. You hear me? Thumbs up. Audrey, okay, good. For teens. And what comes to mind is social emotional intelligence for adults. We all have a little girl and a little boy inside of us. And there are triggers that have happened along the way, energy that we have picked up, things that we aren't even ours. And when I went to the adult training, I was recharged, rejuvenated, and reframed a lot of my stories. So with that said, I'd be remiss if I didn't talk about that, some sort of workshops or retreats for us to really cleanse and get to the bottom and the root of our cause. And I just want to say this, with all the data that we did here in Massachusetts for the last 7 years, in California, they have adopted our training in the LAUSD school systems. We have an MOU. Yes, we do, Audrey. Yes, thank you very much. And it is amazing. And we're working here now in the school system. So I'd be remiss if I didn't say that. We're looking at solutions and we'll bring it up later. And I'm going to give it to the amazing Audrey.
Hello, everyone. Good afternoon. So I just have to start by saying I really am almost a little sad. I went right after Dianne, her presentation, and then just her comments, because she's so awesome that it's a little like, okay, we'll hear from Audrey, but I'm never going to be as electrifying and amazing. So I bow down to Dianne. I also have to say a shout out to my beloveds on this call. I feel so happy just seeing Kim, seeing Jen, Amy, Eve, Joanne, Nerissa, Maura, Lynn. It's like all of my favorite people all on a screen. I feel like I'm embraced by a hug. So I want to thank all of you all. And in particular, Amy, who invited me to be on this today. So I do want to be a little bit solutions focused. So I'm the last speaker we have. I want to send you all off to the best of my ability. And I'm not the superstar with the sultry, amazing voice of Amy. And I don't have Dianne's life experience, but I do want to try to send you off with some good ideas and some hope and share what we're doing here. I am the executive director of the Center on Child Wellbeing and Trauma, with a heavy emphasis on trying to get to the well-being part of that by addressing both on an individual and organizational level trauma, and making sure that we can be, as organizations and as people, as healing responsive as possible, so that we can take all of our knowledge of trauma that we learn every week or every time these calls are on, from each other, from being in the schools, and put it towards being more healing responsive. So I want to start on a personal note, and then I'm going to tell you about the center and then answer any questions with whatever time we have left. And I'm happy to send all this information out that I'm going to highlight through Amy. I'll put it in the chat as well, just so that you all have it and don't feel like you have to scribble down any notes. But I do want to start on a personal level. I got into this work because I am the granddaughter of a Holocaust survivor who always told me that the best way to try to heal our family's pain, our intergenerational pain, was to try to give back to others and try to communicate voices of support and resilience. So I'm going to put my absolute favorite quote in the chat. Actually, that's kind of why I have a lot of favorite quotes, but it is up there. It is Viktor Frankl, who is also a Holocaust survivor, and it says, "We who lived in concentration camps can remember the people who walked through the huts, comforting others, giving away their last piece of bread. They may have been few in number, but they offer sufficient proof that everything can be taken from a person but one thing, the last of the human freedoms to choose one's attitude in any given set of circumstances, to choose one's own way." And what I love about this quote is it is not saying that if you can't choose positive, that's a problem for you. No, this is not toxic positivity. This is, we have some choice and we come together in this love fest, as I just saw Amy say. We are the ones who are giving away our bread. We are the ones who are creating those healing communities. And so I think I'm going to share what the center has to offer. I know every single person who is on this phone call has been offering over the last 2.5 long years, and that together we do have a lot of positivity here that we can use to move each other forward. So with that, I'm going to attempt to share my screen. Tell me if this doesn't work. It looks like it's gonna. So don't laugh at whatever I have in the background. That may not be what you want to see. Okay, I'm hoping right now that folks can see. Diane, will you give me a thumbs up if you can see my screen? And it looks like, yeah, thank you. 2 thumbs up. I love her so much. Okay, so this is the website for the Center on Child Wellbeing. We officially launched in October, but it was actually based on work that had gone on for years and truly bowing down to the work that had been going on for decades by people like Eve and Amy and Lynn and other. I am holding on to a chain of men and women who have created and others who have created great trauma work. Our focus at the center is really on working with organizations. So the goal is that any organization, whether it be a school, whether it be a mental health clinic, whether it be whatever it is trauma-informed and responsive. Now, those words mean a lot of different things to different people. So I'm going to tell you my really quick definition of what it is to be healing responsive. That is taking all of our knowledge that we have about trauma, and if you feel like you want to get more, we have endless information more. It is combining all of that information with what we know about healing and prevention. So we worked really closely with a group called Healthy Outcomes from Positive Experiences to talk about how to put those positive experiences in place for children to try to move us forward. Lots of great information there. We have guiding principles on what it means to be trauma-informed and responsive, and the thought behind that. And I know I'm going through this quickly, but obviously it's all on our website, so you can take your time and go through all of this. The thought behind this is we give you some principles and action steps, concrete steps of what it would take for you or your organization to try to be more trauma-informed and responsive. The last thing I want to do is run an executive role in an organization that does not help people. That is not, I think it was Katie who said, but what can we do now? What would it look like now? People are going down now. We've tried to include really detailed information. What would it look like to build a trauma-informed and responsive workforce? Because we know right now we're seeing a lot of churn in the workforce, especially as Eve said earlier, in early childhood education. So what tools can we give people as organizations and as people? And I'm going to highlight one more section. We have a section here on resources and training. It specifically has toolkits. One is a toolkit for early educators, the goddesses of early education, which is Eve Gilmore and Joanne Gravel, who I think was on here before. I haven't seen her lately, but I think she was on before, built this. And they built you guys such a gift. This is Christmas comes early, Hanukkah comes late, New Year's present. And if you click here, which I won't right now, you get to hear Amy's voice and really cute children with some really good tips. And then we have, I consider them snacklets of learning, so that you can either watch all of the videos, take courses, or you can set goals and pick, I really want to learn more about the classroom environment. And we give very specific goals of what you could do. We also have on here an entire training on racial trauma and equity. That's my personal area of interest and how I got into the work of trauma that is geared towards schools and really tries to work with educators to say, how can we make things better in schools for children of color? So we have all of that. If you're really like me and you're kind of a nerd who wants to really focus on details of what is the latest information out there, we have information for every possible professional that's out there, and you can click on, I want to learn more about how to be a trauma-informed and healing responsive community organization. I really want to work in the judicial system and make that more trauma-informed. So we hope we have a little bit of something for everyone. I also want to make 2 other offers pretty quick. I'm going to take this down because I think people do better when we can see each other a little bit. So I have 2 other offers. Right now, Casey Burns, who I think is a hero to a lot of us out there, and her team, and I think it may be Nerissa also is on that team, but I might be wrong about that. The Worcester Trauma, Resiliency, and Racial Equity group is right now building a community of practice on this work. If anyone is interested in joining, those are all free. I can put you in touch with Casey and that team so that you can register or learn more about it. We are also, through the center, partnering with a group called Thriving Minds that are running programs for schools on social emotional learning with a focus on being trauma-informed and healing responsive. And the last piece is that we would be happy to come in. If you represent an organization, we would be happy to come in. We have a tool called the Trauma-Informed Organizational Assessment. We go through the whole tool with you, and then we say, let's coach you on some areas where you're really strong. We want to learn from you and bring your innovative model back. In areas where you may be struggling or want a little bit more support, we offer some coaching. All of our services are free. We are supported by the state, and we would love to work with you all. So I'm happy to send out some background slides as well as the link to the website, and I can answer any questions that anyone has. And I want to thank Amy for giving us some time to talk to you all today. I really want to underscore what Maura said, this too shall pass. And I think we have the opportunity to rebuild differently and better and maybe stronger. So I offer all of you guys a namaste, a healing hug from afar, and I would be happy to answer any questions that anybody has.
If anyone does have questions, feel free to unmute yourself and jump in. And of course, we're so grateful for all the expertise here, all the commitment, the amazing resources. No, is that a hearing no questions? I know it's.
I have a comment.
All right, bring it.
Audrey, you took us home, okay?
From you, that is seriously high praise. I will be on a high from that.
Yes, you took us home. Thank you for all that information. I'm looking forward to connecting with you. And as you said, Amy, thank you so much for this venue. Kim, thank you so much. And each and every one of you here. What a way to end our year and bring in 2022. I am complete.
Woo!
You are complete.
Nothing more needs to be said. Thank you, Dianne.
So I also have a
Thanks
comment.
so much, everybody. We'll send out the recording soon so you can share with other people in the community. Super grateful for all the work you're doing and the amazing energy in this room. We got Dianne, we got Kim, Maura, Brenda, Jerry, Eve. It's been wonderful. Thank you all so much.
I wanted to just thank everybody
Nerissa.
too as well. I wanted
Sounds like it.
Yes, can you hear me?
Now we can.
I just wanted to say thank you for everyone joining. This was a great group. But I also wanted to remind everyone too to try to focus on the positive. And I know there's still a lot of stigma. We have a long way to go. But think about how long we've come in just our lifetime. That's something to think about. We've come a long way. So we still have more work to do, but we can get there together. Thanks, everybody.
That was great ending comment. Thank you. Yay.
Bye, Maura. Bye, Audrey. Bye, everyone.
Bye.
Bye, Aim. Bye, Dianne.